Cystic fibrosis is a lung disease. It's a chronic illness.
Cameryn was formally diagnosed when she was 2 months old, and the way they diagnose it is a sweat test. Now they have some things that can tell you a little bit earlier, but an infant doesn't sweat until they're 2 months old. When she was born, she had meconium ileus, which means she did not pass her meconium, so she went into NICU, and we were given a list of some things that could possibly be, and CF was on the list.
Hi, my name is Cameryn Rasmussen, and I am living with cystic fibrosis. Growing up with CF, I didn't know anything else besides that, so to me it was normal. I guess I always thought everyone did breathing treatments and everyone ate thousands and thousands of calories a day and everyone went to the doctors all the time, but I didn't know anything else besides that, so I guess it's just normal. It's all I've known. At a young age, it's like you were learning how to do everything for the first time anyway, so it was just one more thing that I did that other people didn't. And then same with pills. I've always had to take pills. I still remember the first time I learned to swallow a pill. That was the biggest thing in my life. I was 6. I was at Cece's, and I remember exactly what booth I was in and everything. It's a big deal because I had to take medicine every time I eat, and so before I could swallow pills, I have to dump it into applesauce. So we'd carry applesauce with us everywhere. It's ridiculous. And so it was a big deal. When I finally learned how to swallow pills. But it's just something I've always done, and I think as I've gotten older, it's got harder because I don't have as many people reminding me to take my medicine or to do X, Y, Z. But it wasn't hard learning to do that growing up because it's the only option I had.
As far as where she is now, we've got 21 years of history with it now. There's been several stressful moments throughout her childhood and growing up. Will she gain weight? Will she thrive? Will she make it to college? Now I look back at some of that stuff and it doesn't seem as stressful because we've checked off everything on this list and she's doing really fantastic. But there's always the stressors out there and different things that could happen.
Yeah, so since I didn't know anything different, that part wasn't hard growing up. My parents were very adamant about the fact that I wasn't going to skip treatments. I was going to be very compliant. So it was just a part of my routine. All my friends knew about it. My friends love seeing me do breathing treatments. They're like, "Whoa, that's so cool!" They love my vest. I just think back to college, and I'm in college, but my freshman year of college, when some of my friends would purposely come over to my house and take naps in my bed, so I could wear my vest and they could fall asleep faster. So this is my vest. Basically, what it does is it just vibrates my lungs to open, to break up and loosen the mucus. So a big part of CF is your lungs are just filled with this mucus, and it's really thick and really hard and stuck together kind of. So this is basically just breaks it up and helps me be able to cough it up. That's lovely. But yeah, so I do this for 30 minutes twice a day. But yeah, I just sit here and shake, and it's just breaking up mucus as we talk. So
That was one of the hardest things for her to leave for her freshman year. And I get, when you're a parent of someone with CF, day to day as they're growing up, there's a lot of involvement. So it's basically letting go and letting her figure that out on her own. And we knew that she would probably have a period of non-compliance, and she did. But it's something she had to learn on her own, and fortunately it didn't affect her too greatly. But she got to a point where she was tired of doing her stuff, and it showed up, and she saw the results of if she didn't do her daily treatments, what that did to her physically. And so fortunately she realized that, and it was a learning thing, just like every young adult learns a lot of different areas of your life. Her health has more of an impact on what she does. So anyway, it's just you have to trust and let go, and know that if you don't let them crash and burn, they're not going to learn. So she went through that, and I think she came out stronger and understands more why it's important to be compliant with her day-to-day medicines and treatments.
I don't know. I wouldn't change a whole lot, and I would probably tell other parents too that as much as you think you'd like to be able to kind of dictate the cards that are dealt to you to the most extent that you can, I would say don't force it. Just it's a part of life. Life has ups and downs. I'd say just roll with the punches, and I don't know. I don't know what I would give as just a great nugget of advice to them other than just go with it. And being a parent is doing the best you can with the circumstances you have. And so I don't really ask ever to have the deck reshuffled for me. I'm just playing the hand we're dealt, and I wouldn't change a bit of it.
So one of my all-time favorite people in the world, Vanessa, she has CF, and yeah, so she's one of the people, I obviously wouldn't have met if I didn't have CF, but she was actually a teacher at my elementary school. So I met her when I was in 4th grade. She was a 4th grade teacher. And one of the things with CF is that we are supposed to be 6 feet apart from each other with other CF patients. So because of cross-contamination rules, basically CF patients have, we harbor bacteria that we can spread to one another that, wouldn't be dangerous to you at all. But to other CF patients, it could potentially, cause them to be really sick or, lead to a really bad infection that leads to death or something. Not to be dramatic, but, so Vanessa and I, we got to know each other when I was in 4th grade. She's, 20 years older than me, but she's probably, one of my closest friends. And we're just able to kind of be there for each other in a way that none of my other friends can, because none of my other friends know what it's like to live with CF, and they don't know what I actually go through, and the emotions and the pain and the joy and the ups and the downs and the roller coaster that is CF. Vanessa understands that so well, and so she's great just to bounce my feelings off of, and she's done it all. She's been in my shoes, and so she just gives super great advice, and just someone who cares about me and is able to understand me more than anyone really can.
Cameryn has never let CF slow her down. We've tried to not make CF a factor in what she could or could not do in life, and so she treats every day live to the fullest, and she, if anything more, it's a motivator for her that she's done as much as she can. So she's never let it get her down.
I've never let CF stop me from doing anything like playing sports or traveling the world or hanging out with friends or going to college and getting a job. So CF hasn't stopped me from doing anything. I just have to do things a little differently, and it might take a couple extra steps to get there, but I wouldn't say I've been limited by CF.
Well, kind of like Cameron's life, CF doesn't define her, but it's a part of her. CF just doesn't define Sandy and I or the relationship we have, but it's sure a big part of it, and it has been for 21 years now. I think Sandy and I have made a really pretty good team, but I think Sandy's strengths have been, she brings a lot more to the table in making sure Cameron's thriving than I do. My wife's really an organized person, and to stay on top of CF, there's so many medications that have to be ordered and just routines that have to be followed and stuff like that. And my wife is a very detailed person, and she really made sure that Cameryn stayed on track with stuff like that. So if it were up to me to do 100% of Cameryn's caretaking as she was growing up, I believe she would probably still be alive, but I don't think she'd be thriving nearly as well as she is, because her mom, her mom really brings a lot to the party when it comes to taking care of her daughter, and they've got a bond that if you know them and you can see them together, it's really cool, because you can see them, growing up. You're the mother, now she's 21, and I can see them having this relationship where they're really good friends. And I consider Cameryn and I really good friends too. We're still her parents, but there's just something really special in that bond between my wife and my daughter that's pretty amazing. And without without Sandy in the picture to take care of things, I shudder to think what things would look like, how different they'd be if it was just me being the sole caretaker. It wouldn't be nearly as successful of an outcome with our daughter as we have now. So mad props to my wife.
When people say, what is CF? I mean, most people don't know what it is. So we usually treat it as more of an educational opportunity to explain what cystic fibrosis is, and then they may have some questions about how does that affect her daily life.
We've always tried to be really open with people about what's going on with Cameryn and her cystic fibrosis. That's just been, it's a part of her. It doesn't define her, but it's definitely a part of her, and sometimes it's a very noticeable part of her. Having said that, when she's growing up, sometimes she will have like a coughing fit in public, or sometimes she has to do a breathing treatment out in public somewhere where people see it and they're not really accustomed to seeing that, or she takes several pills before every meal and stuff like that. It's just a part of her, and so we've always encouraged her, and we've always been really open with it. We haven't ever tried to hide it. It's something that it's just a part of her. Again, like I said, it doesn't define her. It's just a part of her. So we've never shied away from it. We've tried to raise her not to shy away from it, and I think she's done a really good job. I'm very proud of her now that she's an adult, that she owns it. She doesn't try to hide it from her friends, and when she's able to reveal that to people, that it's just a little bit more of, here I am, this is who I am, and she's got great friends. There's nothing to hide from it. So it's just a thing, it's just another chink in the armor, but it is what it is. So we don't shy away from it. We notice some people, you get some looks once in a while, and this, or somebody wants to say, oh, does she need a cough drop or something? Well, no, she just needs a cure, or something like that. But it's just part of CF. It just is what it is, and we just kind of roll with it. And she does a great job of doing that too.
So most of the time when people don't know what CF is, their first question is like, oh my gosh, are you contagious? Am I going to die? And I'm like, yes, because I'm contagious, and I'm purposely putting you at risk by talking to you. So CF is not contagious. You have to, it's genetic.
I think the most important thing is to let them live, experience life, experience things. You have to get creative, sometimes with just the day-to-day details and logistics, but we've always tried to go above and beyond so that she could experience and not feel left out in any activity, whether it's sports or a play or just spending time with friends. But none of us know how long we have in life, so it's just important to let her live, be a child, be a young adult, and live how she wants to. So.
Hit me with your best shot, guys. like bring it on. CF sucks. It's no one should have to go through some of the stuff I've had to go through, and there's definitely a lot of highs, a lot of lows, a lot more lows than there are highs. But like I said, so much of who I am as a person, I credit to CF. And so while it does suck, and it's hard going your whole life being told you have a life expectancy, you have an expiration date, that's not easy. There's definitely been times I've been thankful for having CF, and people look at me like I'm crazy when I say that sometimes, but CF has completely made me who I am as a person, and I wouldn't change it for the world. It's just the cards I've been dealt in life, and so I'm not gonna sit around and complain about it. I'm gonna live one hell of a life, and I don't care. Everyone has bad things happen to them. Everyone has unfortunate circumstances, and CF is just what my life threw at me. So but I've been grateful for it because it really has made me who I am. It's made me completely appreciate every day. I live every day to my best, and it's my last day, and I don't sweat the small stuff, and I'm not what am I trying to say? I think that overall it's made me a better person, and I appreciate the people in my life, and I appreciate breathing and air and oxygen, and so yeah, I'm thankful for CF. I don't wish it upon anyone because it does suck a lot. but but I think that my life has been so great, and CF has also presented me with a lot of opportunities, like really cool opportunities. Like, I got to go on a Make-A-Wish trip. No one just gets to go on a Make-A-Wish trip. Like, that was pretty dope. And I've met some really, really awesome people, and I've met like really cool doctors, and I've got to do a lot of cool things because of CF. And there's certain people in my life I couldn't imagine not being in my life, but they're only in my life because I have CF.